So let's have an overview now, class, of pharmaceutics in general. Okay, so pharmaceutics class is basically a branch in pharmaceutical science that deals with the investigations of the physical and chemical properties of our drug molecules. Okay, both physical and chemical properties. Why? Again, guys, if we want to make our drugs into a dosage form, we need to first understand its physical and chemical properties. Alamin ko muna saan siya compatible, saan siya incompatible. Mga ganyang bagay. A good example of this class would be phenytoin. Familiar ba kayo sa drug na phenytoin? Are you familiar with this, guys? Okay, not so much. Phenytoin kasi class is an anticonvulsant. It's an anticonvulsant drug. Okay? This is one drug class na hindi mo pwedeng isama with D5. Ano yung D5? Okay. Dextrose. Dextrose na lang. Ba't ko pa ginagawang complicated to? Bawal siya ipagsama sa dextrose. Okay? Bakit bawal siya ipagsama? Kasi ang nangyayari, class, pag pinagsama mo si phenytoin at saka si dextrose, nagkikreate ng precipitates. Okay? Nagkikreate ng precipitates. Isipin mo na lang, class, paano kung yung precipitate na yun nabuo sa blood vessel mo? Ang sa tingin niyo pwedeng mangyari? Number 1, pwedeng ma-irritate yung blood vessel. Number 2, pwedeng mag-cause ng blood clots yun. Eh, paano kung yung blood clots na yun pumunta sa puso mo? Ano mangyayari sa'yo? Heart attack. Pumunta sa lungs, pulmonary embolism. Kung yung blood clot na yun pumunta sa utak, stroke ang lalabas sa'yo. We call that class incompatibilities. You'll have a subject for that. Tama ba ako? May separate subject kayo na pag-aaral nyo, puro ganito lang. Ano yung mga incompatibilities ng drugs natin? And for you to understand those incompatibilities, class, you have to first understand the physical-chemical properties of these drugs. Right? So anyway, pharmaceutics class is also responsible for the design, fabrication, and evaluation of drug delivery systems. Okay, so napaka-importante class nito, designing. Okay, how do I make my dosage form? Bakit ba may mga dosage form na ang gamit ay soft gel capsule, like peg ang kanyang component, but yung iba hindi peg ang ginagamit, they actually just use gelatin. Okay, so may mga reasons, class, behind that. Right? And monitor how drug products are absorbed, distributed, metabolized, and excreted in the body. So this one, class, is actually referring to our ADME. Now, part kasi, class, ng pharmaceutics, involved pa rin si Pharmacokinetics. Okay, si Pharmacokinetics, class, huwag niyo kakalimutan to, ha. When we talk about Pharmacokinetics, class, we're simply just talking about ADME. Okay? In kinetics class, puro computations na gagawin nyo dyan, we'll just be talking about the absorption, distribution, metabolism, excretion. Okay? Okay. So, under pharmaceutics class, we have the following topics of discussion, or usually ang mga subjects, okay, or branches, we call them. Okay, of course, we have dosage form and physical pharmacy. These two go hand in hand. Dati, class, ang prerequisite ni physical pharmacy si dosage form. Okay? Pero ngayon, sabay nyo atang tinitake, right? We're taking this together. Okay. So, okay lang yun. Alright? Okay lang yan. Okay? Tapos, of course, kasi physical pharmacy, itong prerequisite ni kinetics at saka ni biopharm. Alright? Now, kasi class, these are all important subjects, okay, or sabihin natin mga branches of pharmaceutics, which helps us design medications, understand the properties of our drugs, and therefore know how to alter them to suit our needs, or to suit our desired outcomes. Okay? So, kumbaga, halimbawa, kung ang gamot ko ay, meron akong napakagandang gamot, pero ang problema, hindi ko siya matunaw sa tubig. Okay? And number 1 requirement kasi, class, ng isang gamot ay dapat natutunaw siya sa tubig. Alam niyo ba kung bakit? Number 1 requirement, class, for any drug, right, it should always be water soluble. Alam niyo ba kung bakit? Although may mga gamot, class, na kahit hindi siya water soluble, kaya pa rin pumasok sa katawan, ha? There are drugs like that, like the ADEK, vitamins A, D, E, K. Familiar kayo dito? These are your fat-soluble vitamins. Okay? Mga fat-soluble vitamins. Hindi niya kailangan maging water-soluble kasi kaya niyang pumasok sa loob ng cells, okay, via phagocytosis. Are you familiar with the term phagocytosis? Narinig niyo na ba ito? Kinda? Yes? Okay, I can see some nods. Good. Okay, phagocytosis, class, is the ability of a cell to eat. Okay, cell eating ang tawag dito. Okay, syempre counterpart niya is pinocytosis. Sorry, ang counterpart niya pala is exocytosis, wherein nag-squirt out naman yung cell palabas. Okay, so anyway, class, one requirements of almost all drugs in the market is that it should be water soluble. For one main reason, class. Our blood class is 80% water. Okay, it's nearly 80% water. Then, andyan yung mga dissolved elements natin. Okay, and other cells. So basically, class, blood is made up of water. A class, for a drug to work, especially drugs designed for systemic effects, okay, I'd like to stress this out, if your drug's desired intended effect is for systemic effects, what do we mean when we say systemic? Buong katawan mo ang epekto niya. Halimbawa, pag binigyan ko kayo ng analgesic, gusto ko buong katawan ko mula ulo hanggang paa, wala akong maramdamang sakit. So I'm going to give you a drug whose intended effect is for systemic actions. Or say, for example, class, infection. Infection ba natin, class, isang lugar lang? Pwede. Pwedeng localize ang infection eh. Kaya nga may mga betadine tayo, di ba? Topical agents. We call this topical. Tahid-tahid lang. Kasi local lang naman yung infection eh. Pero class, pag nag-umpisa ka ng magkasakit, nag-umpisa ka ng lagnatin, okay, ano sinasabi nun sa'yo? Asa na yung bakterya mo? Nilalagnat ka na, okay, nanginginig-ginig ka na, may simptomas ka na. Ibig sabihin nun, yung bakterya mo, kalat na sa buong katawan mo. Tama? It's already affecting you systemically. Pag sinabi natin ka systemic, ibig sabihin kalat sa buong katawan. So obviously, class, ano ang ibibigay ko sa yung gamot? Pang-local? Hindi, syempre. Bibigyan ko kayo ng gamot, class, na ang effect ay for systemic effects. So dahil intended siya for systemic effects, kailangan makapunta yung gamot ko sa dugo. At para makapunta ang gamot ko sa dugo, kailangan, saan siya soluble? Sa water. Kaya nga isa sa mga number 1 requirements, class, for any drug product is that it should be water soluble. Okay, pero class, may mga caveats pa to. Kasi if you want a drug class to enter into the cell naman, anong kailangan property niya? It should be lipid soluble. Okay, it should be lipid soluble. So now, we have to strike a balance. How do I make my drug water soluble enough to be able to be absorbed into the blood, but at the same time, lipid soluble enough to be able to enter the cell? Nagets ba, class? Na-imagine nyo ba? So, ibig sabihin, class, most of my drug products, partially, kaya kung ito yung buong drug product ko, ito yung buong drug product to. May part dyan, class, that allows it to become water soluble, while another part of it allows it to become lipid soluble at the same time. Kaya nga, class, most of our drugs out in the market are considered to be weak electrolytes. Okay, weak electrolytes. Bakit? Because these are partially water soluble, soluble, and partially, sorry, pangit talaga, class, ang handwriting ko. Hindi ko sinisisi yung yung ginagamit ko pang sulat. Talagang pangit yung handwriting ko. Okay, so kaya sasabihin ko ulit para maintindihan niyo ito, ang sinulat ko. So class, weak electrolytes, most of our drugs class in the market are considered to be weak electrolytes because they are a weak electrolyte is both partially water soluble and partially lipid soluble. Okay? So yun. So anyway, class, so yun yung mga bagay-bagay, class, na aralin natin dito. Now let's try to define each and every one of these. Okay, when we say dosage form, class, it's the art and science of formulation and manufacture of dosage forms and drug delivery systems. Ito yung inaaral natin ngayon, kasabay ng physical pharmacy. Kaya ano ba yung mga dosage forms natin? So we have tablets, capsules, aerosols. So what about pharmacokinetics, class? Sabi ko sa inyo, in kinetics, class, 4 na topics lang pinag-uusapan dito. Absorption, distribution, metabolism, excretion. Okay? So those are the only things, class, that you need to study here. Now, kumbaga, class, what are the factors? Okay? Pwedeng both physical and chemical factors that could affect a drug's absorption. O, bigyan ko kayo ng halimbawa, class. One of the physical factors that could affect a drug's absorption is particle size. Okay? Particle size. Sa tingin nyo, sino mas mabilis ma-absorb? Large particle size or smaller particle size?
Smaller. Small po.
Okay, very good. Definitely, class. It's those, very good. Okay? Everyone. So, it's the smaller particle size. Kasi pag mas smaller ang particle size, class, mas madali siyang i-wet. Okay? Yung wettability niya is mas mabilis siyang mabasa. Okay? Inside the body, class. So, therefore, mabilis din siyang transport into the bloodstream. Okay? So, stuff like that. Alright? And of course, dahil maliit siya, mas mabilis siya makaka-pass through sa mga pores natin. Right? So, yung mga ganun bagay class. Or what about distribution, say for example. Okay? Now, this one class would refer to naman sa mga bonds that it creates. Okay? Which is our module 2. We'll be talking about the forces of attractions. Okay? Yung mga bonds. So, halimbawa class, one of the major protein affecting a drug's distribution in the body is albumin. Right? Familiar ba kayo sa albumin na protein? It's the same protein class that we have in your egg. Yung egg white, that's albumin. Okay, we have the same protein class in our body. Right? Ang albumin kasi class, importante ito to maintain osmotic pressure. May separate topic tayo for this. Okay, we'll have a separate topic for this. Osmotic pressure. But at the same time kasi class, albumin also serves as the major binding sites for drugs. Okay, kumbaga, ninanakaw ni albumin yung mga gamot na dapat magbabind sa receptors natin. Okay? And ang involved dito class, of course, will be the forces of attraction, which is either hydrogen bond, or is it creating a covalent bond? I don't know if I've mentioned this na class. Hydrogen bonds is reversible, irreversible.
Reversible po.
Yes, very good. This one is reversible. Na-mention ko na to, right? Okay, na-mention ko na. Tapos covalent kasi class is irreversible. So, ibig sabihin, if a drug binds to albumin reversibly, okay, ibig sabihin nun, hydrogen bonds yung kinreate niya. So, ibig sabihin nun, class, dahil alam kong reversible yung kanyang binding, so I can expect, class, my drug to be released from the albumin sooner or later. So, pag ganyan ang scenario, class, ibig sabihin, ay, mag-aantay lang ako. Kaya halimbawa, sinaksakan kita ng gamot. Alam kong mataas ang protein binding niyan. So, initially, class, dahil mataas ang protein binding niya, saan siya magbabind? Sa albumin muna, hindi sa receptors mo. So, therefore, sasabihin ng patient, ano ba naman yan? Ba't mo ko sinaksakan ng walang kwentang gamot? Wala naman nangyayari sa akin. Pero dahil alam kong mataas ang protein binding ng gamot na yan, at alam kong hydrogen bonds lang yon, sasabihin ko sa pasyente ko, wait lang, chill. Okay? Kung naman, atat ka kagad magkaroon ng effect yung gamot mo eh. Wait lang. Matatanggal din yan sa kanyang binding sites or sa albumin. Okay, pag natanggal na yan sa albumin, yan. Makakaramdam ka na ng ginhawa. Pero syempre, class, when it comes to medications, di ba, ang gusto natin lagi is mabilis yung effect. Right? So what else can I do? Usually, class, pag alam ko mataas ang protein binding ng gamot ko, a good example again is phenytoin. It's 80 to 95% protein bound. Okay? Mataas ang protein binding ng gamot na yan. So normally, class, ang ginagawa natin dyan would be tataasan natin yung loading dose. Eh, pag sinabi natin, class, loading dose, ito yung binibigay natin to have immediate effects. Okay? Given to have immediate effects. Ang maintenance dose naman, class, this is the dose given to sustain the effects. Okay, kaya normally, class, a loading dose will always be high. Okay, mataas usually ang loading dose because we want to have immediate effects. High enough to create an effect, but not too high to create toxic effects. Okay, yan ang loading dose. Okay, mag-alala, sa kinetics class, magko-compute kayo niyan. Okay, ano ang dose na maganda wherein hindi siya tatama sa toxic concentrations. Okay, based on various patient parameters. Alright? So, sa kinetics yun na pag-usapan yan. Pero at least may concept na kayo, class, kung ano ang loading dose at maintenance dose. Maintenance dose is just enough to sustain that therapeutic effect. The therapeutic effect that you want. Alright? So, normally, class, again, balik tayo sa topic ko kanina, kung highly protein-bound ang gamot ko, so obviously, at the first dose, wala akong mararamdaman. Kasi nakabind lang siya sa albumin. So, ang gagawin ko dyan, class, ang regular dose niya, tataasan ko lalo. Mas tataasan ko ang loading dose para, class, kahit papano, merong gamot na hindi magbabind sa albumin but instead to its receptor. Pero anong gagawin ko sa maintenance dose ko? Siyempre, bababaan ko. Kasi sooner or later, yung gamot na nagbind sa albumin, okay, marirelease yun. Eh, paano kung mataas din yung maintenance dose ko? Tapos biglang nawala yung gamot na nasa albumin. Nag-displace na siya. Na-release na siya. So, sobrang dami na ng dose ko ngayon nun. Okay? So, pwedeng mamatay yung patient ko doon. Anyway, lastly, next one will be metabolism. So, this one is more of the various enzymes. Okay? Ang pinaka-common enzyme dito, class, is what we call the CYP450. Familiar? Yes, the cytochrome P450. Medyo familiar ba? Narinig yun, ha? Kinda, no? Okay. The CYP450, cytochrome P450. Marami tong kapamilya. Okay, pinakasikat dyan is the CYP3A. Okay? Ito kasi yung enzyme that metabolizes drugs. Ito yung mga enzymes na galing sa ating atay, liver enzymes. Kaya napaka-importante class ng atay natin. Okay, yan lang ang protection natin against xenobiotics like drugs. Okay, so it's a hepatic enzyme. Ang pinakasikat dyan would be CYP3A. Okay, it's actually CYP3A4. Ang dami kasi pamilya nito eh. So CYP3A4, which is responsible for metabolizing our drugs. Okay, and then lastly, class, would be, of course, excretion. So, obviously, class, ang pinaka-main organ for metabolism would be the liver. But I'm not saying, class, only the liver metabolizes our drugs. Okay? Kidneys can metabolize drugs. There are enzymes, class, in our blood that can metabolize drugs. Alright? Pero nagkataon lang, the major site of drug metabolism is the liver. So, try lang natin, ano ang major site of excretion?
Kidney po.
Yes. Very good. That would be the kidneys. Now, class, all of these processes, the ADME process, okay, may mga computations tayo na pwedeng gawin dito. Right? Let's say, for example, sa absorption, pwede tayo dito gumamit ng Noisepet equation. Okay, dissolution. Distribution, usually ang percent, ano lang naman to eh, percent protein binding. Okay? Metabolism, of course, we have here the Michaelis-Menten equation. Okay? Pag-usapan na lang yan sa kinetics na. And the last, excretion. Okay? Pwede natin isama dito ang clearance, creatinine clearance, it's one. Okay? Or drug clearance in general. So, maraming computations kasi na pwedeng gawin dito. Right? Anyway, what about biopharmaceutics then? Okay? Biopharmaceutics class, this was directly related sa physical pharmacy. It's the study of the factors. Ano yung mga factors na to? Dito papasok nyo yung mga physical, and chemical properties, okay, physical and chemical properties of my drugs that influences bioavailability of a drug in humans and animals. Okay, you might be wondering, sir, ano ang bioavailability? Bioavailability class refers to the amount of drug reaching the systemic circulation. When I say systemic circulation class, I'm referring to
blood po.
Yes, blood. Okay? Kasi nga class, anong sinabi natin? Ano bang goal ng mga gamot natin ulit? Especially for drugs whose intended effect is for systemic effects. Ang goal niya ay
To be distributed whole out the body po.
throughout the body. Yes, very good, Sean. Okay? Throughout the body, specifically, makapasok siya sa blood. Okay? Kasi class, once, ang theory kasi dito nating class ito yung principle na pinag-isipan natin lagi. Basta nasa dugo ang gamot natin, expect natin nagwo-work yan. Okay? Yun yung, pero not all the time not all the time. It's not true all the time. Pero ang general principle na inisip natin is, the more the drug is entering the bloodstream, the more ang kanyang magiging effect. Alright? So therefore, class, if there is higher amounts of drug in the bloodstream, anong expected ko sa kanyang effects? So, anong mangyayari, Miss Kabalan? Okay. Ay, nagulat yan si Miss Kabalan. Kabalan nga ba, Melody? Ayan.
Sir, paulit po.
Ay, sorry. Okay. So, class, kapag mataas, there's an increase in amount of
Increase in
drug in blood, ano expected natin?
effectivity din po.
Very good. Increase in efficacy. Alright? Pero syempre, or effects na lang, wag lang efficacy. Mas maganda ang term na effects. Okay? We just hope, class, na hindi naman sobrang dami ang gamot na nasa blood which leads to toxicity. Okay, so you have to strike a balance between the amount of drug entering the bloodstream. Kasi again, class, sabi nga natin, what separates a drug from a poison? It's simply the? Anyone?
Effect po.
Effect? No? What separates a drug from a poison? Yes, I mean, nagmasa ka ba? Yeah, Miss Melody.
The
Okay.
dosage po. Amount of
Kabalado.
dosage.
Okay, very good. So class, what separates a drug from a poison is simply the dose. Si Paracelsus ang nagsabi nito. Pero anyway,
The dose makes the poison po ata
Yes.
yung sabihan.
yes, the dose makes the poison. But, did you know class, kino-contest na ngayon ito? Kino-contest na ang principle na ito. Isipin nyo, sobrang tagal na ng concept na to, ha? You know class, it's not daw the dose that makes the poison. It's your genes. It's your genetic makeup that makes a poison. Okay? Have you ever heard of that concept?
Hindi pa po, sir.
Hindi ba? Okay, kasi class, yun yung
Yan po ba
naman.
yung, excuse me.
Yes.
Sir, yan po ba
Yes.
yung idiosyncrasy?
Idiosyncrasies, yes, very good. You know that. Alright? Kasi idiosyncrasies, di ba, sabi natin, uminom ka lang naman ng gamot at the right dose, at the right time. Ba't bigla ako nagkaroon ng severe allergic reaction? Ba't ako bigla nagkaroon ng severe, adverse drug reaction to it? So it wasn't the dose that made it a poison. It's something in your genes. Okay? Hypersensitivity, yes, very good. Okay? Tama yun? So, which created that adverse drug reaction. It made the drug a poison to you, specifically. Okay? Because there is a variation in the genes that you have. Ito class ang inaaralan sa Pharmacokinetics. Okay? Alam niyo ba, class, ini-screen natin ang genetic makeup ng human to know, for us to know what drugs can be effective for you or not. Okay? Amazing, no? Kumbaga kasi ito yung tinatawag natin na tailored ang medication mo for you specifically. Okay? Kumbaga, we're using your genetic makeup. Okay? Identify ko ano yung mga enzymes na meron sa katawan mo, what are the enzymes you can produce and cannot produce. So therefore, hindi ko ibibigay sa iyo ang gamot na to or ganyan. Okay? So yun class. Pero generally, sabi natin, okay, general principle is it's the dose that makes the poison. Okay? Pero again, nowadays, kino-contest na nga yun. It's not just the dose. Simply your genes can make a poison. Next, physical pharmacy, yung ating topic. Okay, ang dami ko nang sinabi for other subjects. Wala pa ako sinasabi tungkol sa subject natin. Okay, so it deals class with the physicochemical principles underlying the development of successful dosage forms. So basically class, ang goal natin dito is identify class what are the physical and chemical properties of our drugs that would make a good dosage form. In biopharmaceutics kasi class, ang pinag-aaralan doon is the physical and chemical properties that would make a drug be able to enter the blood. Okay? Be able to enter the body. Biopharmaceutics yon. Sa physical pharmacy, ang pag-uusapan lang dito is what are the parameters, what are the physical and chemical principles or factors I need to look at to make a good dosage form. Okay? So of course, for you to make a good dosage form, kailangan makapasok din siya siyempre sa katawan natin. Kaya we'll be dealing with those kinds of topics din naman. Pero again, our attention will be mostly focused on these physical and chemical properties.